barriers
in the usage of face masks
during this COVID-19.
The COVID-19 pandemic, also known as the coronavirus pandemic, is an ongoing global pandemic of coronavirus disease 2019, caused by severe acute respiratory syndrome coronavirus 2. The outbreak was first identified in December 2019 in Wuhan, China.
The World Health Organization declared the outbreak of a public health emergency of international concern on January 30, 2020 and a pandemic on March 11.
As of August 9, 2020, more than 19.6 million cases of COVID-19 have been reported in more than 188 countries and territories, resulting in more than 727,000 of deaths and more than 11.9 million people have recovered.
Here in the Philippines, as of August 9, there have been 129,913 confirmed cases of the disease in the country. Out of these cases, 67,673 recoveries and 2,270 deaths were recorded.
It has the highest number of confirmed COVID-19 cases in Southeast Asia, ahead of Indonesia and Singapore, and ranks 8th in Asia and 22nd in the world.
The largest single day increases the number of confirmed cases was reported on August 4, when the Department of Health or DOH announced 6,352 new cases.
With this deadly pandemic all over the world, safety measures are in need. In fact, the World Health Organization released some safety precautions in order for us to avoid getting infected.
There are a lot of precautions mentioned by the World Health Organization. These include washing of hands, social distancing, avoiding mass gatherings, staying at home, using of alcohol, avoiding touching the eyes, nose, and mouth, and of course, wearing of face masks.
The World Health Organization advises to wear masks in public areas as to reduce the risk of having the virus. But why do we need to wear a mask?
Masks are recommended as a simple barrier to help prevent respiratory droplets from traveling into the air and onto other people when the person wearing the mask coughs, sneezes, talks, or raises their voice. This is called source control. This recommendation is based on what we know about the role respiratory droplets play in the spread of the virus that causes COVID-19, paired with emerging evidence from clinical and laboratory studies that shows masks reduce the spray of droplets when worn over the nose and mouth. Who should wear a mask? The general public, people who know or think that they might have COVID-19, caregivers of people with COVID-19, and of course, the frontliners. Who should not wear a mask? Masks should not be worn by children younger than 2 years old, anyone who has trouble breathing, or anyone who is unconscious or incapacitated, or otherwise unable to remove the mask without assistance.
There are a lot of face masks now available for protection. But does all face masks really protects us from this virus? Let's see the protection capabilities of different face masks and how the different types of masks work.
We have 3 examples for you. These are the surgical mask, N95 mask, and cloth masks. The surgical mask, also called the medical mask. A surgical mask is a loose-fitting disposable mask which protects the wearer's nose and mouth from contact with droplets, splashes, and sprays which may contain germs. It can also filter out large particles in the air and protect others by reducing the exposure to the saliva and other respiratory secretions of the mask wearer.
The N95 mask. An N95 mask offers more protection than a surgical mask does because it can filter out both large and small particles when the wearer inhales. As the name indicates, the mask is designed to block 95% of very small particles. N95 masks are intended
intended to be disposable. However, researchers are testing ways to disinfect N95 masks so they can be reused.
The cloth mask. A cloth mask is intended to trap droplets released when a person talks, coughs, or sneezes. Asking everyone to wear cloth masks can help reduce the spread of the virus when a person has COVID-19 but don't realize it. Cloth face covering most likely to reduce the spread of the virus, especially when people are in a public setting. And countries that require face masks, isolation, social distancing, and testing early in the pandemic have successfully slowed the spread of the virus.
That's right! Actually, while surgical and N95 masks may be in short supply and should be reserved for healthcare providers, cloth face coverings and masks are easy to find and make, and can be washed and reused.
People at home are encouraged to wear cloth masks because the N95 and surgical masks are in need for the frontliners battling every day. Just so you know, stocks are at risk. That is why the N95 and surgical masks are highly prioritized for the frontliners.
People may not consider the environmental impacts of these masks in the midst of the pandemic. But attention must be paid to an environmental problem that may far exceed the virus itself.
Given that surgical mask is supposed to be worn no longer than one day, their disposal, along with the empty hand sanitizer bottles and soiled tissue papers, is leading to a massive trail of clinical waste in the environment.
Due to the current COVID-19 outbreak, the general population have all taken the precaution of wearing surgical masks. When you suddenly have a population of 7 million people wearing 1 to 2 masks per day, the amount of trash generated is going to be substantial, Stone says. The adverse effects of such clinical debris are far-reaching. Once these are left discarded in an animal's natural habitat, be it land or water, this may cause animals to mistake the trash for food, which could lead to entanglement, choking, ingestion, and death.
According to the World Health Organization's health guidelines, soiled tissues and used face masks must be thrown only into litter bins, while any medical gear used by the affected patients and hospital staff must be sterilized and burned at high temperatures in the dedicated incinerators.
With COVID-19 spreading to the different parts of the globe rapidly, the spotlight will soon be on medical waste treatment management around the world and how effective their measures are. It is our responsibility to follow the necessary guidelines in disposing our masks and other medical gear. After all, it is only through mutual empathy and goodwill that we will see the world emerge stronger from this global pandemic.
Thank you for listening, and as a friendly reminder from us,
Please keep safe, wear your mask, but be mindful in disposing it.
After all, after this crisis ends,
We do not want another crisis to solve, right?
Of course, so as a green mindful person who has the care to protect.
I'll wear a mask and I'll dispose with proper.
For my protection and for the protection of Mother Nature.
we are one in these trying times.
And our Earth is one too.
Let us all be a mask to our nature in this time of pandemic. Thank you for watching.